Hi, my name is John Buse. I'm a professor of medicine at the University of North Carolina. I'm a board-certified endocrinologist specializing in diabetes and obesity management and a former president of the American Diabetes Association. I do need to disclose that I'm an investigator and consultant to Lilly and Novo Nordisk, the two companies that produce these weight loss drugs, as well as many other companies working in the weight loss medication development field. I've been involved in the development of the GLP-1 receptor agonist class of drugs since 1997. I think our group at UNC was the first to ever study a GLP-1 analog in patients with diabetes in the world. When Wegovy was approved in 2021, I started personal treatment with Wegovy for my longstanding problem with obesity with multiple comorbidities. And I lost 60 pounds. All my comorbidities resolved. When coverage for Wegovy was no longer available through the state health plan, I looked for more affordable alternatives. I did my due diligence with regards to compounding pharmacies and was impressed that Triangle Compounding Pharmacy was a long-standing, highly regarded quality organization. And in talking to the pharmacists, I understood that they had exercised great care in sourcing their products and verifying the integrity of the products with really advanced analytic techniques. So I felt comfortable switching to their products and have had a good experience over the last 4 to 5 months, maintaining my weight loss, continuing with good control of my comorbidities and at a certainly more affordable price. I want to congratulate Treasurer Falwell for creatively pursuing how to expand coverage for GLP-1 analogs for weight loss, as it's really addressing a huge unmet need for people in our state and the nation. However, I do think it's essential that these drugs be prescribed and monitored by their usual care providers. These drugs require specific assessments regarding their appropriateness for an individual patient, specific counseling regarding how to take the drug and mitigate potential side effects, specific monitoring to ensure safety, and the appropriate modifications of treatment plans, including the need to change other background medications like for blood pressure, thyroid disease, diabetes, just to name a few. I don't think a telemedicine-only approach outside the usual care pattern is appropriate at all. Finally, I do think that the approach proposed by Triangle Compounding Pharmacy for personalized dosing is a great innovation. We've published studies demonstrating that with lower starting doses and slower increases in doses, the tolerability of the GLP-1 analogs is much improved. We have many patients who've discovered on their own or who have been counseled to sort of break into their pens to get to lower doses and enable slower dose increasing using disposable insulin syringe. The methods proposed for individualized dosing from Triangle Compounding Pharmacy seem to be very well thought out and much safer. So thank you for your efforts to provide GLP-1 receptor agonists to our people in the state of North Carolina with overweight and obesity and medical consequences thereof. Thank you.
In terms of the viral hype that we're seeing everywhere about the potential benefits for a broad range of conditions, what is your view of the future? Is this real? Is this truly an innovation that could affect this broad scope of disease and impact healthcare broadly? Or is it just something that will be an interesting point in time, but be surpassed?
Yeah, there's continued innovation with regards to new products in the pipeline that have even greater efficacy. But I think with the currently available products, the data was first impressive that they were great blood sugar management drugs. And then the data was impressive that they were very good obesity management drugs, lowering weight and improving the associated comorbidities. And then we saw that in people with obesity and cardiovascular disease, it reduced the risk of heart attack, stroke, and cardiovascular death. And now we've seen improvements in the liver disease, which is the most rapidly sort of accelerating problem for people with overweight and obesity in America, that problem is largely resolved with these weight loss products. And lastly, in the last week or two, we've had studies showing improvements and resolution in about half the cases in obstructive sleep apnea, or the sleep disorder where people have to wear CPAP masks. And frankly, this is the first therapy, drug therapy, that's been shown to be effective in obstructive sleep apnea. And lastly, I forgot, in between all that, we also had a study that the drug is associated with meaningful benefits on the progression of kidney disease. And kidney disease leading to dialysis or transplantation is also another problem in people with overweight and obesity. And that's not counting all the other stuff that we're hearing about that, maybe pie in the sky, but improvements in addictive behaviors, tobacco, alcohol, drugs, improvements in cognitive dysfunction like Alzheimer's disease. And we don't know the answer there yet, but there's some promising hints. So, I don't know if all 50% of our population that's overweight or obese with comorbidities needs to take these drugs. But I do think that there are many millions of people, even in the state of North Carolina, but certainly across the country, that can benefit from these drugs.
Thank you, Dr. Buse. It's really wonderful to hear from you, and I appreciate your time today. Thanks.
It's a pleasure.